Hi, so my name is Keisha Williams again, and this is my daughter Serena Williams, and I will most likely be using her for all my videos. Today we're gonna be doing the Huff coffin. So just always remember, once you enter the patient's room, you want to do hand hygiene. You want to identify who you are, and then you want to have the patient identify who they are. Um, it's better to know that you have the right patient than to know that you had the wrong patient because you did not identify your patient. So I'm going to enter her room, wash my hands or sanitize my hands with everything. I do like to use gloves. So if I did not mention in my previous videos about wearing gloves, and I guess it also depends on what. But I've always been told when I was giving my associate's program, things could be transferred from the patient's skin, even if you don't know that, even if they don't have anything or you're not aware that they have anything, it's just better to wear gloves. So I would wear gloves if it was needed. But for video purposes, I'll just say that I'm going to wear gloves. And like I said, I've already done my hand hygiene. And I'm going to enter her room. I'm going to knock on the door, enter her room, and just let her know, hi, my name is Nurse Casey. I'll be your nurse today. And today we're going to be going over the Huff cough so that we're able to help you clear out your lungs a little bit. So the purpose of the Huff coughing is to help them to move mucus from the lungs. So that's pretty much what I'm going to be telling her that we're going to be doing, is helping her to clear out her lungs, get that mucus out from her lungs. And then she's going to tell me her full name, your name, your full name.
My name is Serena Kajal Williams.
And your birthday.
My date of birth is December 21st, Tuesday, 2011.
You don't have to say Tuesday. So this is my daughter, and yes, her birthday is December 21st, 2011. So I'm going to go ahead and demonstrate the video. I'm going to have to tilt the camera down a little bit just so we can see fully. So my face might be excluded. So I'm just going to go ahead and tell her what to do, and then she's going to go ahead and do it. So before we begin, just make sure that your patient is in a sitting position. And also, if you're at the hospital or nursing home, I think not necessarily nursing home, but hospital, you just want to always verify if they arm bracelet. And then you always want to ask them allergies as well. Like, do you have any known drug allergies? Which she doesn't have any known drug allergies, but just always make sure you ask them that. I don't think I mentioned that in my diaphragmatic breathing video, but yes, you do want to ask them about their allergies always. And you always want to look at that bracelet to make sure that they are who they say they are. And if they don't have an arm bracelet, you do want to make sure that they get one, because that is vital to their care as well. So I'm going to have her in a sitting position. So she's going to sit up straight, and then I'm going to have her slightly tilt her head. You don't want the head tilted all the way up here like this. Just a slight tilt. So I'm going to have a slightly tilt her head like this so that it's in an upward position. And I'm going to have her take a few slow deep breaths, and then she's going to slowly inhale through her nose while she does that. So while she's taking the slow breaths, she's just slowly inhaling through her nose. And then I'm going to have her hold her breath for 2 to 3 seconds. Now, with her holding her breath for those 2 to 3 seconds, it will allow, it will allow the air to get behind the mucus in the lungs. So while she's getting the air behind the mucus in the lungs, it's also helping her to maintain an open airway, forcing the air out of her lungs using those muscles in her belly. So she inhales, that air is going to go behind that mucus. She's going to maintain that open airway by leaving her mouth just a little bit open, like in that O, like, yeah, just like this. So she's going to leave her mouth open in that position, so that helps the air to move in the lungs. And then she's going to be using the muscles in her belly as well. So we're going to go ahead and begin and have her take a slow deep breath in to fill up her lungs. She's going to slightly tilt her head. She's going to make an O shape with her mouth just so that she could get that air in, and she's going to maintain that O shape with her mouth. Just don't know, you just like this. You just, yep, it's a little bit exaggerated, but you just make an O shape. And if they can't make an O shape, you could have them put their tongue like this and then they could drop their tongue afterwards, but then they get that open airway in the mouth so that they could understand. So I'll just demonstrate. So when you put your tongue down, your mouth is still in that open O position. That allows you to do the breathing exercise. So she's going to take a deep breath in for me with her mouth, her head tilted, her mouth open in that O position. Take a deep breath. And you're going to have her hold it for 2 to 3 seconds. Then she's going to exhale slowly but hard. Exhale. Good. And you're going to do it to keep your head tilted. And you're going to do it again. Take a deep breath in. 1, 2, 3, and exhale. Now you're going to take a deep breath in again. 1, 2, 3, and exhale slowly. Let's do it 2 more times. Take a deep breath in. Exhale slowly. And 1 more time. Deep breath in. 1, 2, 3, and let it out. So now with the last one, it's always beneficial to help them to like a big cough. So you've had them breathe, get that air behind that mucus, help open up the lungs. So on that last one, you could have them cough, or you could have them cough after every one. But on the last one, it's more beneficial to have them just do like a big cough. So you're going to do it 1 more time, and then you're going to cough on the end. 1, 2, 3, cough. We're going to try it again. So like 1, 2, 3, and big cough. Not really a cough, but that's the whole concept behind it. So you're going to just have them do those breathing exercise. And then on that last one, just a big so that should help bring that mucus out of the lungs. So it's like, I'll sit down. Like a big cough on that. So that's the concept behind the behind the huff coughing when they breathe out. So we're helping them to optimize that, not optimize, but we're helping them get enough air behind that mucus, and that cough should help to bring out that mucus that is in the lungs. So yeah, that is it. What?
As a patient, will I get all of the mucus out of the chest or the air lungs?
The goal is to help you get the mucus out of your air, of your lungs, so that you could breathe better. So when you have mucus, you know how when you're stuffy, you can't breathe properly?
Mm-hmm.
So we're just trying to get it out so that you're able to take more air in and to breathe better.
That makes sense now.
Thank you guys for watching.